Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Nigeria records more deaths due to COVID-19. Latest figure shows 5, also 232 confirmed cases. Imo State Governor Makinde recovers from COVID-19, expected to resume duties at Abia State House, Ibadan. And UK Prime Minister, recuperating in hospital undergoing routine tests, says he is still in charge. Sadly, it's 5 people dead following the coronavirus pandemic in the country. According to the Nigeria Center for Disease Control, NCDC, total number of cases recorded in Nigeria is at 232. The NCDC also confirmed that 33 patients have been treated and discharged. Here's a breakdown of the cases in each of the states, showing Lagos now has 120 cases, the FCT 47, Osun State 20, Oyo and Edo states have 9 cases each. Bauchi has 6 cases. Akwa Ibom and Kaduna 5 each. 4 in Ogun State. Ekiti and Enugu each have 2 cases, with Ondo, Rivers and Benue states recording 1 case each. The federal government, at the briefing of the Special Stimulus Committee on Fiscal Measures, they've identified several areas of fiscal palliatives to support the economy this period. The Minister of Finance, Mrs. Zainab Ahmed, says this has become pertinent because Nigeria is facing significant risks due to the global disruption as a result of COVID-19 and further the decline in international crude oil prices. Mrs. Ahmed further lists the following fiscal palliatives to support the economy, and that's to weather the shocks COVID-19 may cause in spite of the lockdown measures, to include 500 billion naira investment intervention fund already approved by the president, which he says the National Assembly is expected to pass a bill on. The fund is expected to be used for the upgrade of healthcare facilities across the states, also financing federal government's intervention for states and to finance public works program, amongst others. Let's listen to her.
The President has approved the establishment of a 500 billion naira COVID-19 crisis intervention fund. The establishment of this fund will evolve and provide the much needed cash resources from various special accounts already existing in the Federation, and this is a process that we will be doing together with the National Assembly. We've already consulted with them, but there will be a need for them to pass a bill that allows us to take funds from some of the existing special accounts. This 500 billion naira is proposed to be utilized for upgrading of healthcare facilities, as earlier identified by the Presidential Task Force on COVID-19 and already approved by Mr. President. 2, it will also include financing the federal government's interventions to support states in improving their healthcare facilities. 3, it will include the financing and the creation of special public works programs. And 4, it will include funding any other additional interventions that may arise and that will subsequently be approved by Mr. President and, if necessary, also by the National Assembly. With regards to the special works programs, Mr. President has previously approved pilot special works programs in 8 states to be implemented by the National Directorate of Employment, the NDA. This approval was given in early this year, and the works were supposed to take place between February and April 2020, and I'd like to report that these works are currently ongoing. Mr. President has now approved that this program be extended to all 36 states and the FCT The time frame for the implementation of this program will be determined by the MDAs that are responsible for the various pockets of programs that are agreed on. But the principle will be that in each of the 774 local governments, that there shall be created jobs of at least 1,000 persons per local government.
And 6 days after he announced testing positive to the coronavirus, the Imo State Governor, Makinde, says he has now tested negative for COVID-19. He had announced via social media that when he tested positive for the virus, he was also asymptomatic and that he would self-isolate. But in a tweet on Sunday, Governor Makinde announced that he had received his second negative test result for COVID-19 while thanking everyone who prayed and supported him during the period of self-isolation. Now, following the federal government's decision to invite the 18-man team of medical doctors from China to assist in managing COVID-19 cases in the country, the Nigerian Medical Association, NMA, they've described the action as an embarrassment to its members. According to the NMA president in a statement, the doctors' union is dismayed about the decision of the federal government to invite doctors from China when the Chinese government is still battling with the pandemic. According to the president, Nigeria has a large pool of unemployed general medical and specialist practitioners that government can engage instead of foreigners who can pose some security concerns at this time. The NMA is advising the federal government to concentrate on improving the welfare of frontline health workers, providing them with the needed personal protective equipment and other incentives to work. Elsewhere, members of the Nigeria Governors Forum are asking the federal government to cancel all deductions and restructure all commercial debt service payments on federal government and the Central Bank of Nigeria. The call for cancellation is contained in a statement signed by the chairman of the forum, Mr. Kayode Fayemi, after a teleconference meeting of the governors on Sunday. According to the statement, the NGF commends the Presidential Task Force for leading a national response team for COVID-19, but emphasized that the need for a stronger collaboration with the states. The NGF insists that such collaboration should include the administration of palliatives to mitigate the impact of the pandemic. Let's go over to Abia State, where there was an initial apprehension in the state when a suspected blood sample of a middle-aged woman was sent to the Nigeria Center for Disease Control, NCDC. According to the Commissioner of Information, Mr. John Kalu, there is still no case of COVID-19 in the state, but despite that, precautionary efforts are being made by the state government. In the meantime, the government has said it will begin distribution of palliatives from Tuesday, that's tomorrow, for the vulnerable and less privileged. The materials are to be dispatched using identified channels such as churches, town unions, traditional rulers, as well as existing school feeding structure in the state. Let's talk about some more of the efforts and measures to curb COVID-19 in the country and around the world. Joining us is Dr. Kashmir Ifeanyi, who is a molecular diagnostics expert and also the National Publicity Secretary Association of Medical Laboratory Sciences of Nigeria. Thank you for joining us at this time. First, tell us, what's your take on the type of COVID-19 strain that Nigeria is battling to contain?
Yeah, thank you, Millicent, and thank you, Nigerians. I think the strain we're battling to contain within Nigeria is quite different from the strain ravaging Europe and that did ravage China. The reason is that if you look at the statistic you railed out at the onset of this news, you can agree with me that our recovery rates are very top-notch. And having said that, it simply means that the healthcare professionals managing the COVID-19 situation in Nigeria are doing their best and would not be requiring an intervention other than appropriate funding, other than appropriately being resourced so they can continue the good work they have done so far. So far, we've lost to COVID-19 about 5 persons. That's bad though, but then compared to the statistics, the data elsewhere, even within the African continent. Now, having said that, there are still things we need to get right in the response. One of the things we must get right is the issue of testing. As we speak today, in the effort to deal with the COVID-19, testing is not rightly situated. We were told last Friday that we are in deficit of human resources for molecular testing for the COVID-19. That is not entirely correct, because as a responsible professional group, we had profiled our members and had made submissions to the chairman, the Presidential Task Force on COVID, and had copied the Federal Minister of Health and the DG NCDC. And over time, we've waited for an acknowledgement on how to rightly engage these people who had helped to drive the HIV programs in Nigeria, who had helped to drive the TB program in Nigeria using the Gene Expert machine, who had helped to drive the process of the hepatitis B intervention and surveillance programs in Nigeria. The truth is that in country, we have capacity. We have people with skills and capacity in molecular techniques and testing. And we have made available these members, about 170 of them. And as a professional group, we are willing to give them support to volunteer and contribute so we can make testing available in all the 36 states of the nation and the Federal Capital Territory.
So you're saying that there's a lot of people who are willing to join the federal government and tackle this. But do tell us, with regards to some of the efforts so far. For example, we hear in Bauchi State a case of mix-up of information with regards to some of the details of a blood sample that was taken. Tell us, I mean, as a molecular diagnostic expert, tell us how important it is when you need to take a sample, how sensitive it is taking that efficiently so that there isn't a mix-up of details, because you might have male, female, positive, negative.
Presently, you recall that I said the problem and the challenge we're facing with this effort is that the right persons are not providing the testing. And we have people with the relevant and appropriate training to provide the testing. Again, let it also be said that the Presidential Task Force on COVID is doing a whole lot of job, and we commend what they are doing, we appreciate what they are doing. But the point need to be made also that the absence of a medical laboratory expert as a member of that task force is why that committee may not be able to drive the process of testing thoroughly. There is nobody in that committee competent enough to speak on laboratory testing or to provide advisory in that regard. As I talk to you now, I have said the IDH hospital in Lagos, there's a crisis already. People have been mobilized, they've done their best, healthcare professionals, they've given their best, but already there's huge discrimination in remuneration, and it's creating something that is brewing insidiously.
Some of the issues we will be discussing in the course of the program, but we'd like to thank you, Kashmir Ifeanyi, molecular diagnostics expert, also National Publicity Secretary, Association of Medical Laboratory Sciences of Nigeria, on the COVID-19. Still to come, medical experts also weighing in further on the federal government's COVID-19 efforts. Plus, we'll tell you how Britain's Prime Minister Boris Johnson is faring after spending a night in hospital. Join us again. So COVID-19 updates here on Channels Television, still looking at the issues, ways in curbing the spread of COVID-19 in Nigeria and across the world. For more, we have Dr. Doyin Oguyemi, who is a public health physician. She joins us here in Lagos. Thank you for joining us.
Thank you for having me.
Also from Port Harcourt via Skype, the President and Association of General and Private Medical Practitioners of Nigeria, Dr. Ike Ugu. Thank you for joining us. To you, Dr. Oguyemi, especially hearing from the molecular diagnostic experts, where he said on the issue of the presidential task force team, there should be an expert in that failed to help in containing the spread of COVID-19. What do you make of some of the things that he said?
It's encouraged that we have a robust team. So everybody that needs to be on the team should be on the team. But more than ever, we need to be united now as health workers, as government, policymakers, united for one reason, which is to fight the pandemic. And that should be it, really.
Dr. Ugu, what's your take on the efforts so far of the government, the presidential task force, the team in curbing COVID-19?
It's a great idea the government has. That is what is called for at a moment like this. For a country like Nigeria, as it is the world over, we seem to be like a people at war. And there must be a strategic structure to prosecute such a war. And at a time like this, the presidential task force is positioned and should be mandated to play that role for our country in this time. The thing we also think should be done is that this is the time for the country to unify itself comprehensively. This is the time to bring together the entire workforce of the medical profession. This is the time to take away any dividing lines. And this is the time to bring on board men and women of experience, men of competence, the field workers. As a medical practitioner and leader in the profession, we commend the federal government for what they have done. But some of us as doctors, we are asking the national president of the NMA and indeed the field food soldiers like us do not seem to be directly connected and playing the role that we owe this country at a time like this with the presidential task force.
Dr. Ugu, you agree that the 18-man team from China shouldn't come? Are you speaking about the views you hold as well, the same opinion of the NMA president on this issue?
I didn't get that.
The NMA, they've said that they frowned at the decision of inviting doctors from China. Do you also share that view that we shouldn't involve the 18-man team from China?
I share that view completely. We are NMA. We believe that China has got its own problems. We also believe that so far, from available records, our own country has done well so far in standing up for this country, in planning to take on the coronavirus infection. And so far, the progression is not as dramatic, and the cure rate, the survival rate has been impressive. What we need and what we lack is that the health care structure should be empowered. The doctors, the nurses, the pharmacists, the entire health system should be motivated. This is the time we need training, we need personal protective equipment, we need to have drugs available, we need to have testing environment and testing centers. We need to ensure that Nigerians are tested.
One moment, Dr. Ugu, and this is, the case of the 18-man team. Isn't it a case of they're coming from China, or essentially that we have people here who can do the job?
It's more a case of we have people here who can do the job. I mean, coming from China is another, laced with some other kinds of theories we do not need to look at. But the fact that it can be disheartening to think that the workforce here that you have, the trust may not be there to the extent of, thinking of bringing in the team. If the team is being brought, like I hear, maybe because of some equipment or some kinds of things that needs to be used and may need some initial putting through, but not to say that it's to come and do the work here. We need to start, reaping from what we invest in. We invest so much in doctors, in their training up until the university, and what happens after house job? They leave the country and they become stars. They begin to work there and begin to get accolades that could have been here if we had the enabling environment. What we need here is an enabling environment for our healthcare personnel in terms of hazard allowance, in terms of what they need, in terms of training, in terms of every single thing to ensure they're well motivated to work.
Let's see what the Presidential Task Force briefing holds today, hoping that some of these questions will be answered. We'd like to thank you, Dr. Doyin, public health physician, and also from Port Harcourt via Skype, Dr. Ike Ugu. Thank you for joining us at this time. We go over to Imo State, where our correspondent Ito Pekute is giving us an update on the state government's efforts to curbing COVID-19.
It's been a rainy morning down here in Owerri, the Imo State capital, and I can tell you that the weather has enhanced the state government's total lockdown order of the state to prevent the coronavirus disease from finding its way into Imo State. It's no longer news that Imo State is yet to record any case of the coronavirus disease. The streets are still deserted, people are still in their homes, and the state government is still putting all efforts in place to ensure that the coronavirus disease does not find its way into the state. Only yesterday, the state government commenced the fumigation of public facilities, the nooks and crannies of Imo State, and major streets in the state, all in a bid to ensure that the deadly virus disease and other related diseases does not find its way into Imo State.
What we have done today is a practical demonstration of the commitment of this government to ensure that the coronavirus pandemic does not affect Imo State. And by tomorrow, we are going to head for Olu. From Olu, we head for Okigwe.
You could recall that a few days ago, the state government commissioned 6 new isolation centers, accompanied by emergency ambulances, patrol vehicles, and a launch of a toll-free emergency call center for Imo indigents to call in case of any emergency. We'll continue to bring you up to speed with events and happenings around here and all efforts of the state government to ensure that the coronavirus disease does not find its way into the state. From Owerri, the Imo State capital, Ito Pekute, Channels Television News.
From the international scene, a senior British government minister says Boris Johnson is still able to continue running the country despite being admitted to a London hospital for persistent coronavirus symptoms. The 55-year-old Prime Minister announced that he had tested positive for the virus 10 days ago, describing a cough and a fever in a video posted on Twitter. Meanwhile, globally, the death toll from COVID-19 is nearing 70,000, according to data compiled by Johns Hopkins University, while the number of infections has risen above 1.27 million. Well, we have another COVID-19 update, a special edition here on Channels Television at 6 p.m. Thank you for watching. Don't forget, with whatever it is you're doing, it's staycation or lockdown, wherever you are, send us a picture, tweet at us at Channels TV. We'd like to hear from you. I'm Minister Kapai.